We are mindful of the direction and advice of the province and our health unit, so we did make the decision today to limit the number of individuals present here, trying to stay under 50 as been advised. I will say I'm pleased to be back at work following my self-isolation. We have an incredibly dedicated team here at City Hall in our community, and it is an honor and joy to work with them. They have great advice, knowledge, expertise, and they're all great leaders here in our community. The reason we are here today is to continue to inform our citizens from a local and community perspective on the evolving COVID-19 pandemic. As you know, the province declared a state of emergency today. What we did was brought together our healthcare and community leaders to speak directly to our community. We recognize the stress and concern this has on you and your family. And collectively, we ask our citizens to remain calm, stay informed, and follow the advice of our healthcare professionals. It is important to keep our community up to date. The amount of information being distributed can be overwhelming and complex for people. I will say, though, we are all in this together. There will be adjustments to be made, and we must all learn new ways of interactions and communications. If we are to break the chain of transmission, we must follow to the letter advice from our healthcare professionals. Today, the city is announcing, beginning tomorrow morning, City Hall will be closed to the public, and we've been in touch with DSAB, and they are in full agreement. Also, other city facilities such as Public Works and Parks, our wastewater plant, our water treatment plant will be closed to the public except for appointments only. We are working out the logistics to ensure that face-to-face meetings that cannot be avoided will be arranged by appointments with the appropriate protections in place. Our first speaker this afternoon is Paul Heinrich, and he is the CEO and president of our North Bay Regional Healthcare Center, so I'll invite Paul Heinrich to come up.
Thank you, Mr. Mayor. I'm going to apologize in advance for a little less eye contact than usual. As the Mayor referenced, essentially we have an infodemic along with a pandemic, and it's very important that I get every word right and that we rely on trusted sources to reinforce what the Mayor has said. Canada's healthcare experts have all advised hospitals and their healthcare workers to prepare for the worst. As President and CEO of North Bay Regional Health Center, I want to assure all of you that our organization is taking this situation very seriously. We have and will continue to take all necessary actions to help reduce the spread of COVID-19 while providing essential care to those that need it the most. Today, I want to assure our community that we are ready. We have an incredible team of frontline and support staff that are working around the clock to provide care for all of our patients while we finalize our preparation for the inevitable higher patient volumes. The safety of our patients, staff, and physicians is our #1 priority. You may have heard about some of the additional measures the hospital has taken over the last week. Some of these measures might cause you some inconvenience. Please know that all of these decisions are made very carefully with safety in mind so that we can continue to create capacity to be able to provide care to those who need us. Some of these additional measures include restricting visitors. No one is permitted to visit the health center unless under exceptional circumstances as approved by the manager of the respective department. One example would be patients receiving end-of-life care. We would have compassionate reasons to consider the visitor situation in that circumstance as an example. We're doing active screening. All patients and visitors entering the building are screened for risk factors of COVID-19. We are also scaling down non-urgent clinical activity. Patients with existing surgeries and appointments will be contacted directly by the hospital. Your healthcare team will continue to review and prioritize urgent healthcare needs as we work through this crisis. There is a famous quote by Mr. Rogers about how when he was a boy and saw scary things on the news, his mother told him to look for the helpers. You will always find people who are helping. Our helpers are MBRHC's dedicated healthcare workers and support staff who are working exceptionally hard to provide excellent quality care around the clock. And the people behind me and all the people that they lead are also the helpers in this situation. Over the weekend, our staff stepped up to be part of the front line fighting against the spread of COVID-19 by opening and staffing one of the first 17 assessment centers created in our province. We are ahead of many communities in our preparation. This assessment center was able to take the pressure off of our emergency department while also minimizing the potential spread of infection. Our community thanks these staff who helped in the creation of the assessment center, as well as the physicians, nursing, and other healthcare providers providing frontline care. Also, thank you to our partners in public health for the excellent work they are doing managing the demand for the assessment center through their hotline. We are working with our partners, including the city and the health unit, to finalize a plan for various levels of demand for assessment. I want to remind the community to help keep the hospital resources available for the most acute care needs. If you suspect COVID-19, stay home and call public health or your primary health care provider for further instructions. I want to close today by assuring our community that your hospital is ready. All the steps we are taking are being done to help create capacity for us to be able to help reduce the spread of COVID-19 and continue to provide the best care possible for those who need us the most. And I'll now turn it over to Peter Chirico.
Thanks, Paul. And on behalf of the business community, I certainly want to stand here today and let everybody know that business is changing right now. For the next number of weeks, as this unfolds, we'll be tuned to our health professionals for guidance, for the opportunities that may arise during this crisis that we have in front of us. But certainly it's a time for business to step up, show the way, the social distancing that has been requested. We believe that our business community will step up to that challenge to make sure that things don't get out of hand. The next few weeks, as I said, are going to be key, and we certainly hope that all the members of the public will listen to the health professionals as to what they say, provide the guidance to make sure that our community, our province, our country is safe over the next little bit. A number of things from the business side of things. Remember, shop local. They're going to need your support. Buy gift certificates for later purchases. Keep cash flow going for businesses. Certainly be neighborly. That's the best thing that I think we all can do in this time, both as businesses and as individuals as well. The final thing that we certainly want to encourage is to make sure that the business community knows that we are open. It's going to change for the next little bit. Stay tuned and pay attention to what our health professionals are going to give us guidance in the next couple of weeks. Thank you very much, and our business community is behind this 100%.
Thank you very much, Peter. Our next speaker is Dr. Jim Chirico, the Medical Officer of Health.
Well, good afternoon. And I'd like to thank Mayor McDonald and his team for hosting us here today. As you're all aware, a state of emergency has been called today by the province. This has been declared to prevent the spread of COVID-19. And it's understandable that many people throughout Canada have concerns and fears about COVID-19. It is normal to feel that way, and especially when we're not sure what is going to happen. It is important to remember that the risk in our community remains low, and I want to stress that to date, there have been 0 cases of COVID-19 in our district. It is anticipated that COVID-19 will end up circulating in the community, and there will be positive cases. And sadly, there will be more deaths. So far, there have been 5 deaths in Canada, one of which was reported today in Ontario. This should be kept in mind, however, when comparing approximately 3,500 deaths each year from the flu. This is not to minimize what we're facing with COVID-19. Do we need to take this seriously? Absolutely. Do we need to prepare for the worst? We are. Fortunately, there are ways to help keep you and your loved ones healthy. Be informed, be prepared, be protected. This pandemic is ongoing. It changes rapidly, so it is important to stay informed as recommendations may change. The Health Unit's website, www.myhealthunit.ca, provides trusted information and lists other reliable sources to help answer questions you might have. It's also important to be informed about your personal risks and your families. We can help you with that. Give us a call. Being prepared for emergencies is a good idea in general. Power outages, extreme weather are all examples. And it's a good idea to ask yourself what you and your family might need if you had to stay home for a couple of weeks. The Health Unit has detailed information on our website to assist you. We remind you to be prepared, but don't panic buy. You can help protect yourself and the people around you by following simple hygiene measures, such as hand washing or using an alcohol-based sanitizer, not touching your face, covering your cough or sneeze, staying home when sick. It's not recommended that individuals use masks to prevent COVID-19, as moisture can build up in the mask, which makes them not effective. There have been many closures and cancellations, and many people may be wondering if their event should be canceled. It has been recommended to avoid events with more than 50 people, but for smaller groups, you should really do a risk assessment. And there's a great tool on our website that can help you with that. The Ontario government has recommended that bars, theaters, daycare centers, and places of worship close. Restaurants may remain open for pickup and delivery only. I recommend that our district follow these recommendations. It is important that we work together as a community to help slow the spread of COVID-19 and prevent people from getting sick all at once. Ontario has closed all publicly funded schools for 2 weeks following March break. If your child is not exhibiting any symptoms, they do not need to be tested and they do not need to be separated from others. If you are a business owner who is wondering if you should close, then you need to do an assessment of your organization to determine what the right steps are for you. No recommendations have been made to date about closing non-essential private businesses. We do recommend that employers speak to their employees about options for sick days, when possible, to work from home if they are feeling unwell. You should not be going to work sick, just as I'm sure you would not want your co-workers to come to work ill. We also encourage employers to review the World Health Organization's guidance for getting your workplace ready for COVID-19, which we have a link to on our website. The Government of Canada has closed its borders to foreign travelers and is asking anyone who is returning from international travel, including the United States, to self-isolate. Self-isolation is staying home to protect those around you, your family, friends, and colleagues, from possibly getting COVID-19. Self-isolation is an effective measure of prevention. We're asking people to take simple, common-sense steps to avoid contact with other people as much as possible, like you would do in the seasonal flu. If you are an essential worker, such as a healthcare professional, EMS, fire, police, or your job is required to keep the infrastructure of our city running, and you're returning from an international trip, please contact us at the Health Unit for next steps. There has been a lot of talk around social distancing. Social distancing is done to help slow down the spread of COVID-19. This helps the acute care system from being overburdened and overwhelmed. But what does social distancing really mean? Social distancing does not mean that you have to stay at home. You can still go outside and take a walk. Go to the park, walk your dog. If you need groceries, go to the store. We simply recommend that you, while you're outside, you make sure to avoid crowds and maintain a distance of 1 to 2 meters or 3 to 6 feet from those around you. The Health Unit, City of North Bay, and the North Bay Regional Health Center have partnered for an assessment center that can be opened and scaled up if we need to. At this time, the assessment center is not required, which is a really good thing. People of all ages can be affected by COVID-19. However, older people and people with pre-existing medical conditions such as asthma, diabetes, heart disease are more likely to become severely ill. As a precaution, the Health Unit has asked all long-term care homes in our district to restrict visitor access only, compassionate care visitors. The Health Unit also recommends that individuals monitor their own health before visiting older family members and do not visit if they're feeling unwell. Overall, we want to stress responsible use of the emergency room. Testing isn't always necessary. There are no specific treatments for COVID-19, and there's no vaccine to protect against coronaviruses. Over 4 out of 5 people with COVID-19 will have no symptoms or mild symptoms and recover on their own. Should you show some mild symptoms, call the Health Unit or your healthcare provider and follow their instructions. Likely you'll be advised to separate yourself from others, limit your contact with other people, stay home, drink plenty of fluids, get rest and sleep as much as possible. Try a humidifier or hot shower if you have a sore throat or cough. Most people will be better in 1 to 2 weeks. If you need immediate medical attention, you should call 911 and mention your travel history and symptoms. So to conclude, be informed, be prepared, be protected. We will get to the other side of it. And how we deal with this as a community, as individuals, will define us. And I am confident that we will do a great job collectively and people will do what they need to do to help each other. Thank you.
In conclusion, we must start transitioning from what we can't do to what we can do to make a difference. And this must not be underestimated. On behalf of the citizens of North Bay and City Council, I would like to thank the doctors, the nurses, the healthcare professionals, the frontline workers, EMS, first responders, community partners, city staff for their dedication and efforts to serve and protect our citizens. All the speakers here today, including the individuals behind me, will be available to answer any questions from the media. Today we have available Chief Scott Todd, Chief Jason Whiteley, the CEO of North Bay Hydro, Matt Payne, David Euler, CAO of the City of North Bay and his senior team, and Catherine Matheson and the Chair of DSAB, Councillor Mark King. They're available to answer any questions you might have. This Q&A session will respect the health unit and the hospital and our healthcare's professionals' recommendations for social distancing. And those questions that you want to direct to, they'll come up to the microphone and answer your questions publicly. What I do ask the media is just to pick the individual that you want to ask questions of, and then we can go to the next person instead of having multiple people come back and forth. So I'll let the media choose their first individual that they want to speak. Myself? No, I have not been tested. I did consult with Dr. Chirico. He did say that the risk was very low, and I'll let him respond more. But he did make recommendations that I could come back to work when I did self-isolate, but I chose to personally to stay at home and self-isolate just to show that that's a reasonable step to take. So I don't know, Dr. Chirico.
Yeah. Yes. Given Mayor McDonald's history. We looked at what his risks were, and I want to applaud Mayor McDonald for taking the initiative as a leader to self-isolate that he did. He didn't have to do that, but it was great to see him step forward to show people that this is what we need to do as a community, and every one of us, and that the risk was low. And it brings up another very important point, and that is most people do not need to be tested. And I'll give you an example. We've been taking and fielded probably over 900 phone calls at the health unit on our hotline, and of those, very few required testing. I'd say probably between 20 or 30 approximately. And most people, I am so proud of North Bay, because the people will listen to what we're talking to them about. All they want to do, most of them, is just simply get some information, get correct information, and then I don't think we have had any calls that anybody was upset, angry, when they were said, well, we don't really think you need testing. They've been phenomenal, and I'm very proud of the community and how they're helping out and responding to it. Yeah.
So McDonald has taken self-isolated after it was discovered that first case in Sudbury, that individual had gone to the pediatric.
Yeah. Yes.
From the health unit's perspective, what is the recommendation for people who did attend? Are they at risk essentially?
It's a very good question. Certainly, if you were in close contact with the individual that tested positive, yes, you would be at risk. And what we do recommend in situations like that, and similarly in other situations that people are at risk, is to monitor. In that situation, monitor for your symptoms. Monitor to see if you develop a fever, a cough, or shortness of breath. And then immediately you're asked to self-isolate and to give us a call. Now obviously if you become much more ill, then you'll be looking at 911 if you're having really difficult breathing. But for the most part, it's a matter of simply monitoring yourself. I think that when you do measures like that, they have to be timed with what's going on with the pandemic. And I think it is a good step to take when we're early on. And right now, you have to look at the numbers. And and I don't mean to sound callous, when you talk about deaths, every death is tragic. When you look at the actual numbers, when you have 5 deaths out of 55 million people and compare it to other causes, this is the time to bring in those kind of measures, because if we can catch it early, instead of everybody getting sick all at once like this, we can smooth the curve so that those that do get ill will then get ill where we can handle the volume. And that's what we were talking with Mr. Heinrich, saying that, the emergency department is a vital resource and we have to use it responsibly. And I can say that people are stepping up, and exactly what I was saying about the people on the calls, that when they do that, they don't go show up and emerge. And so we've averted, a huge number of calls for sure.
The anxiety part of this, with so many people, the border open, a lot of people coming from Florida, and we're hearing stories of people that are coming back from holidays and still working, and employees concerned that they don't know who do I call? Do I call the health unit? Do I call the hospital? What would your message be to the people that are concerned about that, and maybe the people that are maybe being a bit of it, not to be rude, but irresponsible right now?
Right. I think that it would. You can obviously imagine that it would be very, very difficult for any organization to police all of its citizens. It's very hard to imagine, other than if you were in a country that declared martial law and you couldn't go out of your home. So in those situations, we really rely on people to talk to each other respectfully and say, you may be putting us at risk. They're asking people who are coming in from international countries, they're asking them to self-isolate for 14 days. Will they all? Likely not. We're hoping that they have some social responsibility to do that. We need to make sure that the people that are, as I mentioned, healthcare providers, essential workers, EMS, police, fire, all of those, the infrastructure people, that they give us a call. And what we are saying to them is that we need these people on the front lines. We need to keep them healthy. So I'm really hoping, and to be honest with you, we can't police everybody.
Dr. Chirico, you mentioned 20 to 30 tests had been given. Is that the number for the entire district? Do you have stats on how many?
No, because we don't have those stats, but because we don't, sometimes they won't just be tested at North Bay Regional Health Center. They may be in other venues, as other hospitals, as well as primary healthcare providers can send off tests if they feel clinically it's indicated. But what I can tell you is that we get every single report if it's positive, and through the health unit. And we have to date 0 cases, but we do expect that that's going to happen eventually. And may I just finish, I just wanted to finish a thought that I had, and that, again, I really want to stress that the number of cases, 4 out of 5 are asymptomatic, or if they have, they're mild cases. And it's very important to also understand that when you look at numbers of cases, they are way underestimated because most cases just aren't even being tested or detected. So when you look at mortality rates, be very careful how you interpret them, because actually the numbers are far higher, but you don't even know you have it.
And just as a follow-up, what would cause a low risk to be bumped up to moderate or the next level?
That's a very good question, and what it would really depend on is the number of cases that you would get, and the severity of the cases, and the number of deaths. Now, I can't give you specific numbers, but you can imagine, especially for, okay, what about if we know that there's a doubling time that keeps getting, and more cases arise. And the other thing is, what's very important is if we know that there's community spread. And we know in Toronto there's community spread. We don't have any cases, so we haven't obviously detected any. So those kind of things and public health keeps on top of it. We'll keep monitoring the situation. And that's why we tell people, stay informed, because the recommendations that we have today, because it's such an evolving situation, could be different tomorrow. And that's why you need to stay informed.
Earlier you said that the health unit is recommending that places of business like bars, restaurants that don't do takeout or delivery, childcare centers, that it's recommended that these places close. The message we're getting from the province is that with the state of emergency, these places are legally, they do have to close immediately. So I just wonder perhaps if you could speak to that.
Yeah, I knew that question was coming because it's not, it's something that is enforceable. And the way we work at the health unit is that, first of all, we want to engage with the businesses. We want to, and as we do now, because we inspect restaurants, bars, we do that. And when there's an issue, we talk to the proprietor, and through education, we resolve most of the issues. If people refuse to comply, then yes, there are measures to be taken. But we like to think that give people the opportunity to do the right thing. And this is our community. We all live and work here. And I would argue that those that defy the order, it may hurt their business more from a public perspective. And I think the vast majority of people will comply because they live in this community. They're friends, neighbors, loved ones. So that is in place, but we don't really like to use it unless we absolutely have to.
Dr. Chirico, you've seen the response around the world to the pandemic. Anything locally we've done that you wish we'd done differently at this point?
Another good question. You can always learn from things that you do. I keep looking back to SARS when I worked at the hospital and director of the critical care unit, and then I see what we've done now. And there's a tremendous difference that has occurred from that time. And I think one of the things that I've really learned is that we get through it, and we get through it because of the people we work with. I'm really proud of all the efforts that have, and the collaboration that we've had from healthcare providers, from the hospital, from EMS, from everybody in the community, the mayor, the city, in being very cooperative at the table to work out what we need to do and plan. And so I'm thinking, well, what would we do differently? I really don't think anything, because people don't realize that a lot of the policies, procedures have already been in place. It's their common practice. And since SARS, the hospitals, the public health, businesses, municipalities have all taken measures that we have that most people don't know about. They have their emergency disaster plans that they practice and they model. They have their continuity of operations plan. They have their code oranges, disaster plans. They have pandemic planning. And in the hospital, they have their infection prevention and control, which public health is a part of. We go to the meetings every couple of months. We talk to them. We work with them. And so those practices of screening people were in place before we even knew COVID was an entity. And so it was just another extension of what they normally do and what they're prepared for. So I think that there's so much behind the scenes that, and I really want to make the public aware that, yeah, we're prepared, we're working.
Should the state of emergency be on longer? It's on until March 31st.
Right.
Until April?
It's possible for sure. I think that they've done that to give it some time to look at, you know, what really, nobody can predict what the level of emergency will be. Nobody can predict if it's going to, all of a sudden we're going to get a huge number of cases that's going to overwhelm emergency department. It could happen, and I think that they need to, and basically they reassess every day as to what the state is and what we're finding. And there's lots of measures in place that may have to be deployed, but currently they aren't. Just like the Center for Assessment and Testing does not need to be employed on a larger scale right now, but we have it.
I'd like to ask about reporting. We're seeing pictures everywhere of aisles of being completely out of toilet paper, for example. I'm wondering perhaps what your advice would be to the public who, members of the public who are very concerned about this and are afraid that some of these items will not be available.
Yeah. You know, I was thinking about that, and I was thinking, you know, we live in one of the greatest countries in the world, and we are very privileged to have what we do have. And I think that there is lots of food to go around. This is a time, I think, that people need to be respectful of each other, to help each other. If you have a neighbor that might be isolated, that, you know, on their own, you know, here's a perfect opportunity to extend some help to a person like that. We can share, and we can get through this, and we can do it together. And I would, obviously, you know, people need to be wary of what their own needs are, and I know that they're going to do that. They're going to get what they need. But I would just say to people, you know, think about those that are less fortunate than us, and that I know this community has always looked after people that really are in need. And there are those that are more needed than others, and we need to keep that in mind.
Maybe just one other question.
Yeah.
The phrase that we keep hearing a lot is flatten the curve.
Yes.
So essentially, I guess the idea being that we want to ensure that the number of cases of COVID-19 doesn't exceed the capacity of the healthcare system to handle it. So
that's correct.
As far as addressing that, I guess does that deal with some of the measures that you and some of the colleagues here mentioned, as far as staying home if you're sick, wash your hands, that type of thing?
Yeah, and thanks for bringing that up again, because that is exactly, and I want to emphasize that the state of emergency was not declared because everything is escalating out of control. It isn't. It's being declared to prevent that from happening. Exactly the point you made, that we're trying to delay the onset of illness. We're trying to ensure that, like you say, that curve is flattened so that we can manage the number of cases. And again, I keep going back. Most people that are going to get this will be fine. They'll recover in 1 to 2 weeks. Thank you.
Who would you like next? Yes, it is closed.
And then as far as the closure of City Hall, I guess I imagine council meeting will be canceled as a result of that?
So we had 4 items under the Planning Act scheduled for March 30th. We anticipated 2 of those might have attracted a number of our citizens because they would want to have their voices heard. So just to follow the recommendations from the province and our health unit, we canceled that just to make sure that we didn't go over the 50. And we don't want to put a whole bunch of people in the room. What we've done is postpone that meeting until a month or a month and a half till we know when it's clear that we can go ahead from our advice from our healthcare professionals. The April 7th council meeting was canceled today, and I made that decision in conjunction with our CEO and our city clerk. And the reason we did it wasn't so much that we were expecting a whole bunch of people to go to council, but it was an opportunity for our staff to focus on the pandemic and the measures that we needed to take instead of trying to always prepare some reports. Anytime there's anything of urgent need, or if we have to change something because of the pandemic, I have the ability to call a special meeting. But we thought it was really important that our staff have the ability to concentrate on the pandemic and working with our healthcare professionals and protecting our citizens. So in caution, we canceled it. Our next scheduled meeting, I believe, is April 24th. We're hoping that it can move ahead, but if there's anything critical, we can call a special meeting of council.
And last night, the municipality calendar actually passed a motion. Essentially, they're going to ask the province permission to hold meetings via basically teleconference and not have any issues around the board. Obviously, they're in a unique situation with vacancies like that, but I wonder if moving forward, whether that's something to consider that they might consider as far as that.
I can say that I haven't considered it, nor have I heard from any of our members of council that want to do it. I think our council tends to be more open and have the people in the audience, and unless there's like a majority of council that would like to move to that type of council meeting, I mean, obviously we would listen, but in the meantime, we want to just focus on making sure our staff are working on the pandemic and working with our healthcare professionals. So as this evolves, we'll continue to look and revisit that, but we're always open to council's suggestions and ideas. I do have a number of individuals behind me that are here today, and they're making some changes to their organization. So I would encourage members of the media to maybe ask. You can ask me more questions if you want, but they're here maybe to answer your questions, and it helps get their message out too, so our citizens are informed.
Mr. Mayor, sorry, I'm not sure if you'll be able to answer this, but are you able to give us an update on the other city staffer who was with you, who fell ill, or are you able to?
So maybe what I'll do is I'll turn it over to my CAO to answer that question, because that's more of an operations perspective.
That particular city staffer has not shown any symptoms at all, so doing well.
Good. We focus a lot on the mayor, but I thought we'd also ask about it.
Yeah.
That's good. Good to hear. Thank you. What I had for Mr. Euler was as far as transit buses. We seem to be directing people out of common areas. Any concerns yet of transit buses, scaling things back, only allowing a certain number of people on the bus?
We haven't done that yet. As the mayor and others have said, it's kind of an evolving situation, so we're making adjustments, multiple times a day. Currently, the volume on the transit system is greatly reduced, so we've gone to our summer schedule, which which helps control costs. There's no point driving around with with the buses empty. So at this point in time, that's the response we've had. I think the public is doing a great job at self-imposing kind of getting out and getting around, and with the college and the university both shut down, that's greatly reduced the need for transit.
The second thing I had was, what happens to the staffers? Maybe they're not necessarily employed by the city directly, but like people that work at arenas, things that have been closed. What's their next step as far as an income?
We're working on other issues. For instance, the staff at the Memorial Gardens are assisting in preparation for the assessment and testing center should it need to be popped up. They worked all weekend on putting the materials in place and working with the health unit and the hospital staff to ensure that we're ready to go. There's lots of other things that need to happen, and that's what's going on right now.
So there have been no layoffs then from the city?
Absolutely, and there won't be.
Can you tell us a little bit about that assessment center and where it's located?
Sure.
So as of the moment, we actually have an assessment center operating. What we want to really emphasize is we want the public to call the public health hotline. As Dr. Chirico mentioned, they've fielded over 900 calls and actually only sent maybe 20 people for testing or for assessment and potential testing to our location for the assessment center, which is currently just outside our emergency department. It is in fact operational. The hours, I believe, today were 12 to 4. And essentially we are monitoring the daily demand, which has been managed very effectively, again, by the public health office. And it's very important, I think, for the rest of the public to understand that most people don't need to be tested. By making that call, we avoid people even putting pressure on the assessment center itself, let alone the emerge. So, however, depending on the nature of the disease and how it impacts our community, we are also preparing for an alternate location so that if the need be, it can be scaled up. So we have all of our plans ready to go, and when the demand changes, we know how to upscale it. But it is in operation effectively today. I should say as well, we're continuing to evolve that center, and what we're hoping to do, in fact, I witnessed just as I was on my way here, that we were doing essentially like a drive-through assessment process, and actually that's what we're hoping we can manage for as long as we can to do it in that fashion. So, and I also understand the province is strongly encouraging us today to make sure that it's an appointment-based referral to the assessment center. And we haven't quite worked out the details on the appointment scheduling process, although Dr. Chirico's team, in some ways, by diverting some of that traffic, it's not quite an appointment. We had this conversation just before. It's not like an appointment yet, but it's very similar in that it's diverting out the people that don't need to be tested. I want to make this point. We talked about hoarding from a community level, and the challenge back to flattening the curve and preserving our resources, not just our staff, but also the availability of critical personal protective equipment, swabs that are used to do the test, masks that are important for infection control during certain procedures, and many other supplies are really critically important. What's different about the health system is that there is a very effective centralized process to manage the supply inventory. And one of the things I'll point out, I mentioned earlier that our community is one of the first 17 that are actually in operation effective today in the province of Ontario. As I said before, we are out ahead of the curve in a sense, and our community is well positioned to look after things.
Would that upgraded center be at the hospital as well, or
So I would just say that we're looking at, we have done some work at the Memorial Garden site. It was just brought up, so I would mention that. However, as I said before, it's a constantly evolving thing. We've got a team of experts who are designing and operating this at the same time. And as I said before, we're not going to make it into too big of an operation before it's necessary. So if it works out the way I hope it does, we don't actually need to scale up into a bigger place, but the need may be there. And in that case, we're more than ready, thanks to the help from Public Health and the City of North Bay staff, who I'm so proud to be partners with.
As far as how the assessment center works at this moment, is
Yes.
it only by referral from talent,
Yeah.
or Public Health, or are people allowed to just drop in?
So here's the thing, are people allowed? We're encouraging the public not to just drop in. As I said before, we are going to be moving to some form of appointment system in the near future. And in the meantime, once again, and I feel bad each time I say this because I'm worried about the poor team at Public Health that's fielding all these calls, and they're working very hard. But that is the process. It's worked very well to date, and it has managed the expectations. It has managed the anxiety of people. And I'll double down on this. Most people don't actually require a test. And as I said before, we're very important that we manage all of our supply chain, and we're being, as I said earlier, provincially it's being managed, the supply. And by being one of these first approved centers, we were actually ahead of the queue in a sense for supplies that we may be short of. So that is a very positive thing. Great question.
And with the state of emergency as well, the province is providing additional funding for frontline staff, for example.
Yes.
Do you have any specifics yet on how?
Yeah. So it's all evolving fast, and I think it's kind of like, for the time being, it's do what's reasonably prudent and learn from, first of all, the planning. Dr. Chirico referenced the fact that we do these exercises all the time. We're always ready for this. But we're continuing to learn from other hospitals. We're getting almost daily, well, not daily, I would say hourly, information from our provincial, Ontario Health North, which is part of our oversight structure in the new Ontario Health structure, and they're working very hard to support us and coordinate, make sure that best practices that happen in any other hospital in Ontario, we know what within an hour if somebody comes up with a good idea, and then we adapt and apply it to our own situation almost immediately every hour.
I have a question for Mr. Payne from Hydro. Is there any consideration to change off-peak hours?
Yeah, so that's a provincial initiative, and that'll have to be dealt with by the province. Again, we just implement the price structure. So in the press conference today, that was brought up, and I think it's something that's on the table. It'll be a difficult thing to implement, but if that's what comes down, then that's what will happen.
Has there been an added pressure on power load in the city?
No, we haven't seen any added pressure in that regard. And again, we're taking the very similar steps that the city's taken in shutting down our office. That happened effective this morning, and we're doing a bunch of other things to get ready for this.
I want to ask about the letter that was sent out by yourself earlier today. You referenced that anyone who's experiencing any sort of hardship by the current situation that we're in can discuss payment options with Hydro. What if you give us a sense of what that might look like? Does that involve deferred payments?
Yeah, so we're going to be as flexible as possible. I think it's going to be a case by case, but again, our core value here is keeping power on in the city. And going through this situation, and we think it's critical that people have power. And we're talking about self-isolation. Imagine having to self-isolate and not having power. So again, we're being very empathetic to that, and we'll work with everybody, and not just residential customers, commercial customers as well, big and small, at trying to maintain service continuity.
Some of the added precautions that North Bay Police Service is taking. I guess the Ontario Provincial Police did put up, say today that they're asking people to not come to police facilities unless it's by appointment, for example? Is North Bay Police asking the public to do the same?
So last week we went into what's called enhanced monitoring of the situation involving the COVID-19 virus. We had discussions with Public Health, the North Bay Regional Health Center, the fire services in North Bay last week in regards to preparation for that. Fortunately enough, I worked with a strong and dedicated group of managers and leaders within the police service who had instituted a very good policy and practice in regards to PPE and protocols to go in place in regards to a situation similar to this. Much of the lessons learned during the SARS crisis of 2003. We went to enhanced monitoring, and we also went to restricted access on Sunday. We're asking people that come to our police building to only come there for an essential reason or a purpose in which they actually request to either speak to a police officer or receive a service in which we provide to them. Some of the examples may be the taxi industry, in regards to our traffic office, when criminal record checks, background checks we do. If they are coming to the building, we ask them that it be an essential service that they do require. So right now it's restricted access. We've posted the protocols within our lobby. We ask people to use the hand sanitizer. We've also instructed our staff in regards to what they should look for and be precautionary on in regards to their interactions with people in the public. And all of our officers are also prepared and well informed about what they should be looking for too, so that we can assist and be part. Everyone has a part to play in this, and the police service wants to do that too.
What are your officers doing when they get to that 911 call? How is that changing now? And you feel that it's seen where there's a lot of people.
Well, we've asked our officers, first of all, to ensure their own safety first. So carry their PPE, their personal protection equipment, which would be eye coverings, a mask and gloves. And then we've asked them to enter into dialogue with whoever we're responding to. If it's EMS has additional information they can share with us, or if it's us responding along with fire, what information can our dispatchers get in regards to the incident and pass on information to our responding officers so that they can prepare themselves for the incident.
Have there been any incidents related to the situation at all?
We have received some 911 calls, people looking for information on COVID-19, the virus, and of course we provided them with the 1-800 number that's available for public health now, and that's what we're tasking people to do, is call either the 1-800 number for public health to get information on the COVID-19 virus, so that we can free up our 911 lines for the emergencies in which we respond to.
So you haven't had to respond to any panic calls with people relating to, I mean, you guys go to a lot of mental health calls, and I'm sure at some point there's going to be some panic call like that from somebody at some point.
The potential is that some people may not understand the seriousness of the COVID-19 virus and when we're responding to them. And again, our officers will practice officer safety first, but also help ensure the safety of the people we're responding to. But we haven't responded to a call yet like that.
Okay, so the question was precautions that we're doing in the fire department. So we've moved to phase 2 of our continuity of operations plan, so which includes enhanced cleaning of equipment. We've already had well-established PPE and universal precaution protocols. They haven't needed to be changed based on the COVID-19, but we're reinforcing that with all fire staff. We have limited access to the public to the headquarters station. Denying access to our 2 substations. That's just so we can maintain emergency response. Our fire prevention division in our phase 2 operation, we're rescheduling non-essential or non-urgent fire prevention requests. Any requests coming in are being triaged. Of course, any life safety or immediate fire threats will be triaged, and a game plan for that inspection will be put forward, but we're still continuing with that. And then the fire administration team has been well involved in the emergency planning for the city.
Catherine, would we be able to ask you?
So the mayor announced that City Hall will be closed as of tomorrow, and DSAT operates here. So what's going to be happening with clients that come in on a need-by-need basis?
Sure, thank you very much. So we've been communicating with our clients as well as through the public that the DSAP services will be going to appointment only. So that's been happening over the last 24 hours, so we're ready for the change. So emergency situations will always occur, and we will be structured here in order to be able to deal with those as well. So no one who's in an emergency situation would be turned away, but if they have the capacity and the means to call in, then we'll be encouraging all those that require assistance to call in directly.
Certainly, both through the Canadian Chamber of Commerce and the Ontario Chamber of Commerce, we're in discussion with both levels of government. I know the government has pledged a number of dollars so far. I think that as this evolves, that will either ramp up and be able to assist small businesses which are going to be affected through this. Just recently, the Feds announced the one-week waiting period for EI will be waived. So that's a start. Again, as all of the partners here in the room have said, that it is an evolving situation. Those will be dealt with, no doubt, as these not inconveniences but realities come forward to our small businesses. I know that many small businesses are in that sort of flux situation. Do we close? Do we open? How do we do this, especially with the social distancing? I think that everybody is going to take the necessary precautions to make sure that our general population is safe right throughout Canada, and that the governments will step up and be able to take a look at what assistance that they can provide for businesses that are going to hurt and individuals during this period. The Chamber itself in North Bay, we are going to close our offices tomorrow with the hub with Creative Industries, Tourism North Bay, Discovery Routes Trail System, and downtown North Bay. There will be somebody staffing the phones for emergencies and to be able to refer that, but in an effort to do our part as well, as all of the partners have stated today, that will be effective tomorrow morning.
We're all good. So I just want to take this opportunity to say, from my personal perspective, the leaders behind me and the leaders that are in the room, they are dedicated, they're knowledgeable, they're experts in their field. They're doing everything they can to protect our citizens. So the message really to our citizens is to follow the protocol and advice from our healthcare professionals. One of the best sites to go on is our health unit, which I believe the media will make available. But I can tell you that we're doing everything we can from a city perspective. Our community partners are doing everything they can. We're taking our direction from our healthcare professionals. But I just want to convey that I have a tremendous council, and they're engaged. Our city staff are engaged, and our community partners. So I want to thank each and every one of you from the media for being here today to be able to get the information out to our citizens, and just remind citizens, because I know this is being broadcast live, to stay informed, stay educated, stay calm, and if you have any questions at all, absolutely reach out to the health unit or any other healthcare provider. So thank you for your attendance today.